It's great to be with everybody this morning. So, what I'd like to do is talk about reintroducing ourselves to society, using knowledge and wisdom to apply to the information we've gotten. What does that actually mean, and how do we move forward? But I first want to preface this with this. These are my thoughts. This is based on my knowledge that I've been collecting since January, being a physician, being a clinical researcher. I have a clinical research company. Being a small business owner, I've been working for the last month and haven't actually earned anything. I've been working just to keep my own employees employed. Being a parent, I have children. I have family members that are sick. I have elderly parents. Both my parents are in their 80s. I'm just like you. I'm just like everybody else. I've got skin in this game, just like everybody else. So these are my thoughts based on all of that. So at the level of the community, what shall we do? At the level of the locality, what do we do? The level of state and ultimately federally, the people that represent us should represent us. There's a lot of talk about people. We're not in the age of the oligarchs, the monarchs, or the kings. Our leaders are not actually our leaders; they're our representatives, and they're supposed to represent the will of the people, and also, at a certain extent, to protect us. So the question is, at what point in time are they? What's the next step? That's the basic gist of all this. So I'd like to talk about something: knowledge versus wisdom. This is the age-old discussion. Book knowledge versus common sense. So how do we apply? How does this apply in our current situation? What is knowledge and what is wisdom? Well, first of all, knowledge is just the accumulation of information to create a body of data, and that's what we've been doing for the last 3 months. We've been creating a lot of knowledge, but how do we apply that? Well, that is wisdom. Wisdom is the application of knowledge. So to date, the biggest application has been social distancing. The question is that now the still appropriate application with wisdom of the knowledge that we have gained? And that's the question I'm going to try to talk about briefly. One of the issues is we're currently relying on experts for public policy. The question is, are we relying on those who can accurately apply knowledge, or just those who have lots of knowledge in a limited field? So what do I mean by that? Well, it's kind of like the difference. I'm a medical doctor, so it's kind of like the difference between a oncologist and a cardiologist. So if you have a general cancer, you can go to most general oncologists here where I'm at in the Richmond area. There are some special types of pancreatic cancer where you actually probably want to go to Johns Hopkins down up in DC, or Duke, which have really specific pancreatic centers. Now, you would not go to a cardiologist and ask them about your cancer, would you? You would not ask your plumber about foundation work, would you? And so different fields of expertise have different knowledge bases, but the question is how do we go forward with these experts? Our culture prizes experts, but ultimately experts have a limited field of expertise, and usually we require policymakers or people or other generalists, so to speak. In my field of medicine, I'm a family practitioner. It's my first board certification, so my field of expertise is actually as a generalist, as a purveyor of knowledge in many places, but not a particular specialty in one place. So I think our issue is the issue of the technocrat versus the generalist. Again, the question is, at what point do we use information to then apply it? Because that's all we've been doing right now so far is collecting more information, collecting knowledge. But now, how do we, with wisdom, use that knowledge? And we've been holding back, waiting for more information, more information. Now the question is, do we have enough information to move forward? Okay, so for the last 6 weeks, a lot of y'all have been paying attention to what we've been talking about, and there's been a lot of talk that the numbers might be 10, 20, maybe 50 times higher than what we thought. And there's some information actually coming out now that says that is correct. As well, for the last 4 to 6 weeks, we've been seeing these mortality numbers come down and down. So if you all remember initially, the concern was 4 million Americans might die. Well, that number has been coming down and down and down. And as of this morning, the projections are 60,000 Americans might die through August 4th. Now, put that in perspective, in a typical flu season, 40 to 60,000 people will die. The caveat to the caveat is we're talking about a minority of the population has had the disease so far, so that the data that up to 250,000 people will die from this is still accurate. It's just we've been flattening the curve, which means we've been broadening the curve. So what we've been seeing two phenomena happen. First, the phenomenon within the data that we're saying more and more people may have this, so the mortality numbers may be coming down, which is actually true, which we'll talk about in the second part. The other thing about this is that the mortality, which is we were all worried about how many people were going to die, it's come down from the millions to the hundreds of thousands to now 60,000. So what was the point of the lockdown? It was three major things. One was to flatten the curve, but we broadened it. We did not get the curve we expected, right? The second thing was to allow hospitals to prepare, which we've done. We've done actually fairly quite well. And the third thing was the third thing was to get more data, which we've done. So how do we move forward with all the above? Have we gotten the right amount of all the above? What are our next steps? Do we need more data, or do we have enough data to move forward? Those are the questions we all should be asking ourselves, our friends and family, and our representatives. How do we move forward? And that's what I want to talk about in part 2. Please follow the next link, and we'll talk about that in part 2.